My vision for food and health is that the two, first of all, systems work closely together so that we can make Canadian citizens more healthy and get rid of chronic problems like obesity, hypertension, really reduce the levels of those. But also at the same time, really help our agriculture and food industry be more successful and also more innovative in creating new products that are really world-leading in terms of contributing to the health of individuals.
I think anyone's vision for food and health would be twofold. First of all, that the public are educated and practice what they learn about the importance of healthy eating.
And one of the things you realize is the population ages. The good news is we are aging and we're living longer. The bad news is it's got a lot of costs associated with it. So I think the vision we have is really to try to get ahead of the increasing cost to actually make people healthier so they have a longer and better quality life.
One of the defining definitions of Canadians is a public health care system. Right now, approximately 50% of our provincial budget goes to health care. My vision is that we can lower that percentage by the proper use of functional foods to reduce the probability of disease.
20 years ago, when I entered government, Ministry of Health used to spend about 32 cents of every dollar on health care. Now it's 46 cents out of every dollar. When you look at how much investment, just $21.7 million over the last 10 years in terms of additional investment, that's more than the budgets of the Ministry of Agriculture, Aboriginal, Municipal Affairs, Northern Development and Mines, Labour, Children and Youth Services, Community and Social Services, and it's still $500 million left over. So just think of where all that investment could go to actually better both healthcare and the quality of lives.
I would hope that by 2020 we would have the infrastructure in place to enable our citizens of this country to eat good, healthy food produced by our local farmers and to be aware of what that healthy food was, so they are making the right choices.
I'd like to be able to see the consumer walk into the grocery store or the farmer's market or anywhere else where they encounter food and be readily able to identify what products they should be choosing from the point of view of health.
The challenge is a much more efficient and expeditious regulatory system. That's a challenge. But the opportunity is for academics to work with government policy regulators to help streamline those policies.
And what we want to do is align not only our activities in government, but the activities of our nonprofit groups, our researchers, our agri-food industries, the public, to make sure that we get the best return on all of our activities. Right now, I think there's a lot of activity, but we need to align our strategies.
I don't think you're ever going to get rid of things like the junk food, etc. And I don't really think you have to. I think people need to, however, sort of gradually start to rethink their diets. And if they do that, and if they're allowed to go gradually, they will be able to adopt a healthier lifestyle and healthier eating habit. But they have to, the emphasis has to be on gradual, because that's how it's going to be permanent.
I think the opportunity is to simplify the message down to that core problem. It's that 100 calories. So when I talked about 100 calories would have $60 billion of impact in 2010, well, 100 calories is two-thirds of a Coca-Cola.
Government and researchers and industry all have to work together on this. Not any one of those three has the solution, and none can be a solution independent of the others.
The most important thing for industry, government, and researchers is to work together. I don't think we've been working together, and I think it's time that we started, because we're sicker now than we've ever been, and we pay for it as the Canadian population.
The whole approach to trying to use medicine to fix people when they become unhealthy is probably not as good an approach as trying to figure out how to keep people healthy. And food's a very big part of that.